I'm gonna give it a few more seconds. We have a couple more that may be joining us. We want to have everybody on the webinar for this particular webinar. I'm excited. Colleen Hughes is here, and I'll introduce her later, but she's one of my very favorite speakers. She knows this, and she's a partner of our team, and she just has it so interesting. I could just hear it over and over just because it's so relevant. And I'm not going to steal her thunder and get into it, but it's so relevant to all of our partners here in Virginia and our local communities, and how we can take what she's going to share with us today and really work in our communities. But again, I'm gonna go ahead and get started. We have a good crowd on the webinar this morning. Welcome again to our Tobacco Free Tuesdays webinar. It's August, and we might as well say it's December because time kind of zips along just like that. But welcome. I'm excited to have you all here today. If you were not here when I opened up the webinar, you can continue to put any tobacco ad from your past or from yesterday that you kind of stood out to you as something the tobacco industry really puts out there to really attract young people, especially older people, just everyone, to really kind of hook them as they begin their addiction. But excited to be here today. We will be doing the chat in the Q&A box. So please, as Colleen is presenting, put any questions in the Q&A box. And Nicole, I know will do the chat feature at our very end of our webinar. We had Nicole here from the Eastern region, Portsmouth Health District. We have Tiffany Eustace here from the Northwest region. She's with the Blue Ridge Health District. Sarah Burkhead with the Central region and the Richmond Health District, and Carrie Cannon with the Northern region at the Fairfax Health Districts. This is your tobacco control team, and we again welcome you. And we would like to start out with our first tobacco, what's the T question, just so we can kind of get a feel of what you already know out there. So I'm going to get Sarah to put that up. What are some recent ways you've seen or heard of tobacco companies reaching new audiences via advertisements or product placements? And you can choose all that apply: direct mailing, coupons, concerts, public events, public display and art, social media and influences, advertisements in store, streaming services, gaming sites. So choose some of those. And these are ones that you've actually probably seen. We want to know what's out there in your community that you're seeing. So take a few minutes or take a couple seconds and put some of your choices in there. And we will see the results. Okay, so it's again, all of them, right? The tobacco industry really knows how to do the advertising and really target to our young people and everyone really. The highest was advertisements in stores, and that's something that Colleen will talk to definitely in her presentation. I will say, with the Tobacco Control Act of 2009, it kind of limited a lot of the marketing, tobacco marketing and advertisement, but they're coming up with new ways of doing it. I'll tell you too that I've really noticed lately are the social media and the influencers, especially on our younger audience. That's where all of our youth are really hearing everything, and they trust the influencers, and that's where, and tobacco industry knows this. And the other one is Netflix or streaming services. And I pulled this information, 79% of our shows most popular with the 15 and 24-year-olds depict smoking prominently. So while they're not able to do the advertisements, they have the free advertisement because they get the actors to do it in the shows. So again, the tobacco industry knows what works, and they know what will impact our young people. But right now, I have the pleasure to introduce Colleen Hughes. Colleen Hughes is a state Synar coordinator employed by the Virginia Department of Behavioral Health and Developmental Service in the Office of Behavioral Health and Wellness. She has been working in the field of prevention since 2007, and she has made the prevention of youth retail access to tobacco products a priority by renewing the state's Merchant Education Initiative and launching a statewide retailer verification project, which includes individual store audits to help shape the retail environments of the communities across Virginia. And this is where Colleen, probably in the past 5, probably even more than that, the work that her office and the local CSBs have been doing is phenomenal. I know we have several people on the call this morning that have done the work, and Colleen kind of details the work that has been done so that we are aware of the environment that tobacco products are sold in Virginia. So again, Colleen, I said that you're like one of our team, and you are. She used to be the chair of the Tobacco-Free Alliance of Virginia, and we welcome you to our webinar this morning. I'm going to turn it over to you.
Well, thank you, Gina, and the rest of the team. I'm super excited to be here. Thank you for all the kind words. I do want to just right from the get-go tell you this is not my work. This is the work of the community service boards across the state. And without them, there would be no presentation because they really are the boots on the ground and are the ones that make this happen. I'm just kind of the figurehead of it. So thank you all so much. I really, I love working in this arena, and I'm going to just jump right in. I hope that you find the information helpful, useful, and then there'll be time for questions. So if I don't touch on something, then just put it in the chat and we'll address it. Let's see. Now all of a sudden, there we go. All right, so Virginia, this is kind of just a little highlight of it. About 4,300 square miles, 95 counties and 38 independent cities. These are all broken down into 40 community service boards or CSBs. So you'll hear me reference CSBs. This is what I'm talking about. And then those are further broken down into 5 regions. Just random information, Virginia is actually the 35th largest state in the nation. So Synar, it does not stand for anything. Synar is actually the last name of the legislator who put this into this law into practice. So Synar specifically addresses youth retail access to tobacco and nicotine products. When the federal age rose to 21, then so did the Synar regulation. And Synar regulation requires states to do a couple of things. The first is to enact laws that prohibit the manufacturing, retail, and distribution of tobacco and nicotine products from selling or distributing to anybody under the age of 21. It requires the states to enforce these laws, to conduct annual unannounced inspections that provide a valid probability sample of outlets and to see if they're selling to minors. And then we need to achieve a non-compliance rate or retailer violation rate, RVR, of no more than 20%. Non-compliance to this, so if our RVR goes above 20%, then our penalty is up to 10% of the total substance abuse and prevention treatment block grant. So for Virginia, that 10% is about $4.2 million. So it's no chump change. Here's a little bit of history of what that retailer violation looks like. 2015, 16, 17, and 18, we were hovering right around that 10% mark. And then in 2019, we jumped to 16.8. And that, for all intents purposes, is what our current rate is. Inspections in 2020 and 2021 did not happen because of COVID. We partner with Virginia ABC to do these inspections. They're the enforcement body for the state. And because of COVID and safety reasons, their agents were not out and about doing inspections, whether it was for ABC inspections or my Synar inspections. So we do have a gap in our data there. Unfortunately, it was just really bad timing because this is also when the state and federal tobacco 21 law took effect. So I don't have really good data about how that impacted this retail violation rate just because of poor timing. I do want to point out that this big jump between 2018 and 2019. And a lot of that has to do with an FDA grant or an FDA contract that was held with ABC. That contract ended in May of 2018. So between the FDA inspections and the Synar inspections, we were inspecting about 50% of our retailers annually. When the FDA contract ended in May of 2018, that left just the Synar inspections. And those currently only inspect about 15, actually less than 15% of our retailers annually. Senate Bill 96 happened in 2014. This is the bill that made it illegal for anyone under the age of, at that time, 18 to purchase and possess vapor products. So that's when vapor products were included into our Synar inspections. Virginia is a non-licensing state, which poses a problem. We don't have a really good idea of where our retailers are or how many retailers we are. And that's something that we end up addressing, and I'll talk about shortly. Counter Tools Phase 1 and 2 addresses this concept of we don't really know where our stores are. And then along with that, we included and ramped up our merchant education program. All of these things I'll talk about more in depth. And then, as I mentioned, in 2019, Tobacco 21 was passed on a state level and then again on a federal level. And so that made all of the previous ages of 18 move up to 21. So I had said counter tools, and we didn't have a good idea of where our retailers were, how many we had them, or any information on them. So our phase 1 for counter tools, and this occurred in 2016, was to verify both the listed and unlisted tobacco retailers that we had. So how did we do that? We partnered with the community service boards, and thank goodness for them, otherwise this would have never happened. But by partnering with them, they went out and they drove every primary and secondary road in their catchment area. And that was over 56,000 miles that were driven so that we could go and verify these stores. So what did we learn from that? Well, initially our list of retailers was about 4,000. We added lists from the FDA, we added our own Synar list, we added retailers from a Dun & Bradstreet list, and so that brought us up to about 8,200 retailers. By doing that ground truthing, that verification, we removed about 30% of stores because they weren't tobacco retailers. These included restaurants that didn't sell. They included the pharmacist's house in a cul-de-sac that clearly wasn't selling. And it actually included stores that had been closed for so long that trees literally had grown through them. So those were all removed. And I think what's most important is this ground truthing added about 2,000 stores that weren't on any of our lists. So that's 2,000 stores that would have never been on any sort of list, never been subjected to any sort of compliance check or anything. So 2,000 stores that had no reason to not sell to the 15, 16-year-olds that were coming into their stores because they knew they would have never gotten caught. So as of, and I mean, this was as of a few months ago, I'm sure it's changed because the tobacco retailer landscape changes all the time. As of right now, we're saying that we've got 7,626 current tobacco retailers. And then this breaks down by store type. You can see that convenience stores with or without gas make up the majority of our retailers. These are, you know, your convenience stores. It's your 7-Elevens, it's your, you know, Bob's Quick Mart, it's all of those. Followed by grocery stores and then mass merchandisers. Mass merchandisers would be your Walmarts, your Sam's Clubs, your Costco's, and your Dollar Generals are actually considered a mass merchandiser as well. And then we have tobacco shops, drug stores or pharmacies, e-cigarette and vape shops, other stores that aren't listed, hookah lounges, bars and restaurants, beer, wine, liquor stores, and then smoking bars is how we kind of discern what type of store we're looking at. So I said that we went and did ground truthing, and when we were out, I say we, when the CSBs were out there, they actually took GPS coordinates of each retailer. So I can tell if they were at the front door or if they were in the parking lot when they took these GPS coordinates. And this is important when you start talking about proximity, because an address on the street can be very different than the GPS coordinates. And so when we start talking about distance from places, it really is important to have a very exact pinpointed. And so our map is very exact as far as our retailer locations are concerned. So we look at proximity and density. Proximity is the measure of the distance between tobacco retailers. We usually think of it in relation to youth-friendly venues, so schools or parks, daycares, those kind of things. Proximity is measured in feet, miles, or kilometers. Density is the measure or the concentration of clustering of tobacco retailers. And those are usually measured per 1,000 population. So like it says, the example is 1.2 per 1,000 people. The national tobacco density average is 1.5, just for information. So when we look at density by CSB, this is kind of what it looks like. You've got the smaller dot that's is less than 1.5, so less than the national average, with the larger dots being 3.0 or higher, which is more than twice the national average. So the highest density community service board in Virginia is Eastern Shore, which is all the way to the right-hand side, and that's at 3.7 per 1,000 people. So one of the things that we can do with our mapper is to kind of overlay different information. And so here I just grabbed retailer density versus income. The lighter the yellow or the beige color, the higher the income. So the brighter the yellow, the lower the income. And so what you can see here is a pretty clear picture that demonstrates the higher density areas are those of lower income. And we know that this is important because we know that tobacco retailers tend to target areas of lower income. Another thing that we can do is this policy tester. So we can pull through and look at a bunch of different things. So on the left is Virginia as a whole, and on the right, I just pulled Richmond City as a comparison. And so when we talk about policy, we talk about retailers within 500 feet of another. And so that's the tallest bar that you'll see. The second bar is talking about schools, and that's in relation, we use a 1,000-foot buffer for that. And then that third bar is whether or not our stores have a pharmacy. So when you're comparing Virginia and Richmond City, you can see that Richmond City has a higher concentration or higher density of stores than the state does. 75% of their retailers are within 500 feet of another. And then Richmond City also has a higher than state average of retailers near schools, but a lower percentage of those retailers have pharmacies. When you look at the policy tester, this is what it looks like in relation to retailers around schools. Again, the smaller dot is less than 20% of retailers within 1,000 feet of the school, and the larger dot is 50% or more with retailers within 1,000 feet of the school. So you see the bigger dots up in Northern Virginia. That has a lot to do with just population. They have a lot of stores up there, and so it stands to reason that they've got more retailers. around the schools as well. So phase two, that was phase one. Phase two consists of merchant education and store assessments, and we focus a lot at the point of sale. And so the campaign is Counteract. ACT stands for Always Card Teens, and now I just make it fit to the age increase. So Always Card Teens and 20s, I guess. Maybe it needs an extra T. I don't know. So why does point of sale matter? Well, we know that the tobacco industry spends over $1 million an hour keeping tobacco cheap and visible in retail stores. This money is spent on product displays, on price discounts, and the overall spending increased to $9.7 billion, that's with a B, in 2012, with $7.8 billion on cigarette price discounts alone. So why does that matter? Why is it important? Well, when I show you these pictures, this is what you see when you go into retailers, particularly your convenience stores, where you have these walls of tobacco. And despite the fact that every consumer product wants to be at the checkout counter or that point of sale area, the tobacco industry dominates it. Every customer, young, old, smoker, non-smoker, successful quitter, they're all exposed to these pictures and these scenes when they go in, whether they're just buying a bottle of water and some gum. This is what they're faced with. We see the signage all over the store. We see it on the outside as well. And beyond the signs, everything's branded. Your shelving units are branded, strategically placed around the store to really kind of entice them. And one of the things that we look at is what advertisement looks like, but also where products are placed. We go back to this one with the Swisher Sweets and the cigarettes that are literally right next to the M&Ms and adjacent to your Honey Nut Cheerios and your other candies. So it really kind of says that, it's right here. It's kid friendly almost. At least that's what it portrays. And then, like I said, we've got these price promotions that are also, a lot of money is also spent to keep products cheap. So youth exposures to products and ads. This quote comes from Philip Morris. It says the ability to attract new smokers and develop them into a young adult franchise is key to brand development. We know that the placement of signage and products is not by accident or coincidence. We know that our tobacco industry is targeting youth, and here it is in black and white. And I think, with the addition of vape products and the marketing that has been done around that, we know for sure that this is 50 years ago all over again with just a different type of product. So youth exposure really kind of says some things that we don't want it to say, right? Exposure to tobacco displays and to the product itself kind of sends the message that it's accessible, it's easy to buy, and that its prevalence use is higher than it actually is. And we know that it increases the odds of ever smoking, it increases the odds of experimental smoking, and there's a higher likelihood of becoming a daily or occasional smoker. These are a little old, but I think they still are pretty relevant. In Canada, studies shown that schools with a higher proportion of stores within 1 kilometer or walking distance have in-store tobacco promotions have higher school smoking prevalence. So more kids in that school smoke. And then in California, same thing. Schools with higher numbers of tobacco retailers within walking distance have higher school use or higher school prevalence. So we know that being able to walk to schools really does increase the exposure, which then increases the likelihood of using. And that's why that proximity piece is really important. And so to have a database that shows that, I think is really telling. and can be a very powerful visual for people. So I mentioned merchant education. Every 2 years, the CSPs go out and visit 100% of the retailers in their area. It's every 2 years because I'll be really honest with you, we don't have the resources to do it any more than that. We have some CSPs that only have 30 stores. And so yes, they could go out every year and do it. But then I have other CSPs that have 600 stores. And we're not giving any given any additional funds to do this. So we have to use our existing funds. And we are stretched very thin, just like everybody else in this world. But so it is every 2 years that they go out, they do merchant education with, ideally it's the owner or the manager. And then they'll do a store assessment, which we'll also talk about. I am working on doing an online merchant education platform so that it'll be everybody that works in the retailer that would be able to have access to this. Right now we talk to one person, we cross our fingers that that information then gets disseminated to the rest of the staff of that retail establishment. Hopefully with the development of an online version, it'll be accessible to everybody. And I would love to see it written in legislation that has to happen. So fingers crossed that all plays out in the way I want it to. So I mentioned the store assessment. So this is just kind of a screen grab that every store that we go to, we verify that it's there. We verify what kind of store it is. And then we also look at all of these other things. Store name and location. Can you survey the store? We ask questions about the store exterior, meaning are there advertisements? Are they on the doors, the windows? Are they by the fence? Are they on the gas pumps? What kind of advertising is there? Same for in-store advertising. We look at what products are advertised. Is WIC accepted? What's product placement looks like? Do we have tobacco or nicotine products within 12 inches of other kid-friendly items? And so that would be your chips, candy, gums, sodas. Are there functional objects? Are there trash cans that are branded? Are there lights that are branded? Are there clocks that are branded? All of those things. And then we look at tobacco products themselves. So we ask questions about cigarettes, cigarillos, cigars, smokeless, vapor products. And we've actually just added in some alcohol questions for something else that we're doing. But we also look at prices. So what's the cheapest pack? We look at we have everybody look at a very specific product and give us the price for that, so we can see how prices compare across the state for the identical product. We ask about promotions. Are there price promotions happening? And then we do merchant education, like did they receive the packet? There is a pledge, which I kind of skipped over real quick. There's a pledge that we ask the retailers to sign. Most of them are already doing something on that list already, and so it's a pledge just to continue doing that. Some of them are, removing products that are self-serve or removing advertisements from 3 feet and below. And so if they agree to that, then they mark it on the pledge, and then we keep a copy of it, or we keep record of it. So we talked about products, and again, I just did a grab from random places. You can see Virginia and Norfolk City and how they kind of compare as it relates to menthol products that are available in retailers, cigarettes, cigarillos, smokeless, e-cigs, and then large cigars. You can see Norfolk City has almost, double the amount of retailers that have large cigars as compared to the entire state of Virginia. We also look at flavored products, like I said. So cigarillos, large cigars, smokeless, and e-cigs. So these, while you're looking at these do not align perfectly. So yes, cigarillos are still the most common. In Virginia as a whole, it's smokeless, but smokeless is actually third in Norfolk City, and then e-cigarettes and large cigars are in different places. But you can see that there's a large amount of product that are available in flavors. Why is this important? Because we know that it's the flavors that attract our youth to start using these products in the first place. So real quick, looking at snapshots, looking at average prices by community service boards. So the smaller the dot, the larger the price. So this is kind of opposite. Little dot prices are $5 or more. Bigger dot means they're less than $3.50. You can also sort it, if you look at the key, you can also sort it by Newport menthols, which is the one product that we grab across the state, as well as blue e-cigarettes that we grab pricing for. Although that one's a little more difficult because blue cigarettes are not as widely available. We're looking at switching that product out for something different, a different vaping piece, but they're because there's so many different variables in vapes, we have not settled on just one product. And by variables, I mean you've got starter packs, refill packs. You know, there's so many variables with them that we're just trying to figure out consensus-wise what we can figure out. So it also can be displayed this way. So cheapest single pack of cigarettes by county. Southampton County has the most expensive one at $6.60, and then Scott County has the cheapest one at $3.08. And then I just kind of threw in some other ones to give you an idea of what those lines roughly represent. And then again, we can overlay this with different demographics. Again, I just chose the income, and you're going to see the same thing on this one that you saw with your density. So the cheaper the product, the lower the income. So price promotions, this is just statewide. I didn't grab anything in particular. This is just state. I said earlier that the tobacco industry spends over 80% of their marketing dollars at the point of sale on price promotions and strategies to reduce the price of tobacco products. Expanding perceived availability of tobacco products encourages impulse buys. Hughes cravings undermines quit attempts. And we know that low income and youth populations are especially price sensitive, and reductions in price increases the likelihood that they can afford to maintain their habit or experiment with a product. So almost 50% of our retailers had price promotions on cigarillos. You know, these are the Swisher Sweets, right? The 2 for $1, or the grape flavored ones, the ones that are really attractive, particularly to our youth because they're flavored and they're cheap. Almost 46% had promotions on cigarettes, 43 on smokeless, almost 35 on menthol, 28 on e-cigarettes. Well, I think what's important to look at is the cigarillos that are less than $1 and cigarillo singles. That is a very large percentage of our stores across the state that have those available. We're looking at 87 and 92%. So let's talk a little bit about advertisements. We know that exposure to in-store marketing is linked to tobacco initiation, specifically increased odds of ever smoking, experimental smoking, initiation, and becoming a daily or occasional smoker. In 2014, the Federal Trade Commission reported that the tobacco industry spent $294 million on promotional allowances given to tobacco retailers in order to control that strategic shelving and the placement of tobacco products. A lot of retailers place tobacco at eye level of children near candy or in special vendor-assisted displays. We'll talk a little bit more about that as well. You can see statewide, over half of our stores have outdoor ads for tobacco products. And then almost 22% have ads within 3 feet of the floor. 3 feet of the floor is chosen because that's eye level with children. And so that's something that we kind of keep tabs on. When we talk about product placement, when I say 12 inches within kid-friendly products, chips, candy, gum, sodas, you can see that 12.6% statewide of our retailers have products near candy, near youth-friendly items, therefore kind of giving that impression that the tobacco and nicotine products are not as harmful as we know that they are. And then looking at Tazewell County, which is Southwest Virginia, they have almost 18% of their stores that have product within 12 inches. And then accessibility, this is self-serve displays. These are, oftentimes it's those cigarillos that you can just grab and go. We really do want to try to eliminate those because from a business standpoint, they're easy to steal. So you're losing profit margin there. But it's also these younger kids that are going to be taking them. And we certainly would like to prevent that. So statewide across Virginia, you've got 14% of stores that still have self-serve displays. When we are in a store that has a self-serve display, the CSBs do ask them to take those down and at least put them behind the counter so that they're not self-serve anymore. And then same thing, Tazewell County, Southwest Virginia, similar to the other one, they've got just over 10% of their stores that have self-serve displays. Let's talk a little bit about youth and e-cigarettes. We know that there's potential harm to e-cigarettes. I think that's been pretty well documented that they may be safer, but they certainly are not safe. And then I even question the safer part. But knowing e-cigarettes are the things that our youth are using. And so this is what it looks like across the state. Self-serve placement of e-cigarettes, just about 10% of our stores have a self-serve e-cigarette display. Almost 90% of our retailers sell flavored e-cigarettes. And then the price of the menthol blue disposable on average is $9.05 across the state. So we have all of this information. What are we going to do with it? So there's a bunch of possibilities that can be done. I am working with a local planning development committee, and they're using some of the data that we have to address vape stores because they know that it is a problem. But what are some of the things that we can do or that we can ask our retailers to do or future policies even? Limiting the number of exterior advertisements, limiting the number of interior advertisements, making sure that we don't have those advertisements placed below 3 feet of the floor, really looking at where the product is actually placed, ensuring that it's not within 12 inches of these youth appealing products. And then there's also, a possibility of increasing the price. Everybody, of course, goes to a tax increase, which is great, but there are other ways to affect pricing if we don't allow promotions or if we don't allow coupons to be used. Those all have an impact on product price. The more expensive it is, the less youth-friendly it'll be. So here is the point of sale toolkit. That's what POST stands for. That's the website. It is a public site that you can access. If for some reason you're not finding the information that you would like to find, by all means, message me and I'll be happy to help you find it. We've got information on the local level. We've got it, by county, by city, by CSB. It's there. the CSBs have worked tremendously hard on gathering this information. And if any of it is useful to you, then I want you to be able to access it. So feel free to reach out to me with any questions, or like I said, if you can't find what you're looking for, let me know and I'll find it for you. We also have the Virginia Store Mapper. This gets updated twice a year. It's a little, the display of it is a little different. You can see on posts that it's just big circles with a number in it. On the mapper, it is every one of those little red dots is a retailer. And so there's a little bit of different functionality on it, with a little bit of different information on each one of those sites. Again, there's the address for it. If you need help with anything, please reach out. I'm certainly happy to help navigate however I can. And then here's my contact information. Email me, call me. If this is information that you think is helpful, please share it. I don't want it to go to waste. I'm certainly not one for having all of this and keeping it to myself. The more people that can use it, the better. And you know, I have to say, I have a passion for this. It comes from the fact that my mom was a smoker for 50 years, and she passed away in 2010 from lung cancer, before my oldest child was born. And so my youngest child's never met her. And so if I can do this work, and if I can stop one person from starting when they're 15, 16, 17, 18, then I can spare their family from going through what our family went through. And to me, then I've done my job. But I think I've actually timed this pretty well, Nicole. So I think I've managed to leave myself 15 minutes for questions, which, yeah, let's question.
Perfect.
I'm
Thank you, Colleen.
sharing,
Oh,
if that's
sure.
okay, just so I can see questions that may have come up.
Perfect. So we have some from registration, some from the chat, and then one in the Q&A. So I'll start off with one in the chat. Earlier, Robert Spiller asked about enforcement. So in 2020 and 2021, how many Virginia tobacco retailers were prosecuted or fined for illegal sales of tobacco products to persons under 21? Do you have that information?
2020 and 2021, there were no Synar inspections because of COVID. And so the answer to that would be 0 from the Synar side. The FDA side is a little different. I told you that in May of 2018, the FDA contract was no longer being conducted or held by ABC. There was a good amount of time where Virginia did not have a contract, but that was finally, excuse me, I was going to sneeze. That was finally awarded to a third-party contractor at the end of 2019. They were not able to do any sort of inspections at that time, and then of course COVID hit, so they were also not allowed to go out. If I remember correctly, in about a year's time frame, a year ago, I'd say, they had only done about 200 underage inspections.
Oh, wow. Okay. And another question to kind of follow up with that is, someone asked if Virginia has a contract for a contractor to do retail inspections, and you said there's a third party. Are they still under that contract, or no?
So the FDA contract was awarded to that third party, and they, to my knowledge, they still hold that contract. And now that, you know, FDA is allowing people to kind of go back out, I would hope to see an increase in the number of inspections that are happening.
Okay. And in the Q&A, Robert, I think this also kind of goes with what we were just talking about. Who in Virginia government and who in the FDA is responsible for getting Virginia back into the FDA retail inspection program?
So we're in that program. It's just not being done at the same level as it was when ABC held that contract. And some of that, like I said, has to do with COVID, because that kind of put a stop on a lot of people's work. Initially, that third-party contractor had problems getting permission to actually do enforcement within Virginia. Based on what little's happening in there, I guess that it's been resolved because there is enforcement happening. And like I said, hopefully, you know, FDA restrictions have lifted, COVID restrictions have lifted. So we'll see some more activity around the FDA. Unfortunately, I mean, at this point, there's been very little enforcement between FDA and Synar in the last since June of 2019. So there's not been, I'm going to just go, there's not really been any enforcement since Tobacco 21 has taken effect. And I'll be honest with you, the retailers know it. You know, they're smart. They know that they're not being inspected at the same frequency that they once were. And the odds of them getting caught are very, very slim.
That's understandable, definitely. And that reminded me of one of the questions. Hold on, I'm trying to keep it a good flow. So like you said, there hasn't really been that many inspections, you know, enforcement. So because of that, we really haven't seen the impacts of Tobacco 21, right? So once, you know, it was a federal law, you know, it was first Virginia and then became a federal law where you have to be at least 21 to purchase tobacco. And, you know, I guess, you know, COVID and like you just talked about, you know, we don't have that information yet, right?
I will say that Synar inspections will be conducted this year. So we will have a new number. So 16.8 will not be the case. I would love to say that it will go down, but I know what I'm dealing with. And so I think we're going to wish that we had 16.8 as I anticipate it to go higher.
Oh, okay. Oh, wow. And then once there are more enforcement cases, is it like accessible? Is it published somewhere for the public to see from Virginia?
So FDA inspections are on the FDA website. Those you can actually look at and you can sort them. Synar inspections, violations that happen with that get reported to, well, there's an annual Synar report that gets published. But the actual individual like locations get sent to the corresponding community service board. And then they go out and do merchant education and have a conversation with them before they do anything else.
Okay, great. I actually don't think I knew that answer. So I'm glad someone asked that question.
Yeah, they don't just get violated and ignored. The CSPs go out and have conversations with them and just kind of redo their merchant education. And you know, offer their support in any way that they can.
Definitely. And from all of these inspections and all the data that you've collected, what do you think is like the most surprising data or something that has stood out, you know, from CSPs going to collect all this information?
Yeah, you know, we do. There's a bunch of information that we have that I didn't even touch on. But honestly, I think it's more of the conversations that are happening between the CSPs and the store owner, manager, whomever we're speaking with. And you know, the thing that surprises me the most is that retailers really are struggling with vape products in the sense that they've got parents that are coming in to purchase it for their kids who are underage, and they don't know how to navigate that. And that seems to be a big struggle across the board with parents that they're just allowing their underage kids to use those products. So, you know, we're looking at it from an education standpoint across the board, like education with the youth, but we also clearly need to amp up education with our adults and our parents around the dangers of it. I think there's still a lot of myths and just misunderstanding around what vapes really are. You know, if you're not immersed into this work, you probably don't have that information. And so I think, you know, that's one thing that we're looking at is how to increase everybody's knowledge on what these products really are.
Definitely, I agree with that. I remember going out to when Valley was really big, going out to like PTA meetings and meeting with teachers and staff, and you know, they're just being so surprised by just, you know, the ingredients that I talk about, you know, are in these devices.
Yeah, well, the whole misconception of it's water vapor, like it's not. It's an aerosol. Like there's this, you know, water vapor sounds, you know, not horrible. But when you say aerosol, then that's a whole different thing.
Definitely. Okay, we have some more questions that came in. There's one from Isaac in the Q&A asking, what can CSBs do to minimize vape shops from having a store near school? So I guess maybe they looked at that the Counter Tools website with the mapping and everything.
Yeah, you know, it's working with your development, your county or city planning development group. And that's what we're doing in Chesterfield County. Chesterfield County is actually really concerned about the number of vape shops that are popping up. And so having this data as they move forward has been helpful in the sense that, you know, they understand proximity, they understand density, and really just being mindful of that. So it's information that you might want to get to your planning development. You know, the CSBs can be a voice. They can certainly educate on the importance of maintaining a distance between, you know, and kind of what the impact of that in-your-face marketing and those advertisements and being within walking distance, and having what that impact is on youth use rates, I think is what's important to touch on.
Yeah, I think that's a great question. I know some areas have, you know, policies where, you know, tobacco retailers can only be, you know, they have to be a certain distance away from schools and preschools. And so you just have to make sure it's a really well-rounded policy and comprehensive. We have time for maybe a few more questions. One more in the Q&A is, what is the timing for release of the next Virginia Synar report that would have the data for the Synar inspections being done this year?
So Synar report is due December 31st. So it will be released the end of November, beginning of December. I have to have like a public comment period. And so I don't like waiting for the last minute. So I usually try to get that done in November so that I can submit the final copy of it beginning of December.
Okay. And will that be published for the public to see, I guess, the following year in January?
Yes.
Okay.
So it'll always be available on our public facing, like our website. But then it gets sent to the feds, and you know, they used to do a big publication of it. I've not seen one recently. That may just be because there's so many states that have gaps in their data because of the pandemic.
That's true. And then one more question. There's a question about online retailers. You know, people are wondering, you know, who monitors online sales to minors. You know, some people I guess technically they're supposed to check ID when delivered, but it doesn't always happen. Is someone monitoring that? Is there, I guess we'd report to the FDA, right? If we know of anything.
Yeah, so online is not anything that we've touched on with the work that we're doing. Again, it comes down to resources. And believe it or not, this is not my full-time job. This is just half of my job. I've got something else I do. And so we just don't have the resources to take that on. But I know that you can report it to the FDA and they will address that, the online piece of it. There needs to be more work done on that. I mean, it's like whack-a-mole, you know? Like there's just so many.
Definitely. And I know myself, I had a citizen call me about something with Jewel and some product. I think they thought like a store was selling like not real jewels, but selling them as jewels. And so I reported it to the Center for Tobacco Products and they got back to me pretty quickly. So
Right.
I think they really monitor, that phone line and get back to people. I think it was like the next day. So, if you guys see anything, don't be afraid to report it. And I really do think they, pay attention to that as well. So again, thank you, Colleen. I think that's all the time we have. I think we have 2 minutes. So I wanted to pass it to Gina to kind of wrap up everything, say a big thank you. So here you go, Gina.
Thank you guys. I appreciate the opportunity to share this data, and truly reach out to me if you've got questions or want something specific to your location.
Thank you, Colleen. This has been great. It shows just how important this work is to Virginia, but especially to each of the communities, and how we can take from what you presented and work in our local communities to really tackle this. One thing that struck me from your presentation, those big dots, the lower income, lower prices, greater retailers, proximity and density, most of those were Southwest and Eastern Shore, and that's where you have the higher prevalence of tobacco use. So it's no surprise to anybody, right? So this is why this is so important, the work that we're doing. Again, thank you all that joined us today. Please share this webinar. Next month, September 20th, we will be hosting Jim Pavlik. He is with the Behavioral Health and Wellness Department at the University of Colorado, and he will really touch on tobacco use, substance abuse, and mental health, and how we can kind of be aware of that and work that in through all of our programs. So enjoy the rest of your August, get ready for fall, and hopefully we will see you again in September. Have a great one. Bye.